Well, we're running a little bit ahead of schedule, which is good. One of the things we're very keen to do, as I've said, is to showcase some of the great research that's going on around the university. We have done over the last couple of years, invested strategically in some of our best research ideas, some of our best research teams, and there's a couple of them here today to tell you what they've been up to, what they've achieved so far, and where they're heading. So my great pleasure is to introduce Dr. Sonja March, Senior Lecturer here in Psychology, who has been building our research expertise in the field of innovative mental health solutions. So without further ado, I'll hand over to Sonja. Please give her a welcome.
Thank you. Thanks, Peter. Today I'm going to talk to you about our research program, which is the Innovative Mental Health Solution Program, and it's a program designed to enhance the mental health and health of people living in regional areas and well-being. So today I'm going to be joined by Dr. Michael Ireland a little bit later to tell us about a specific project that we've just started to kick off, but we wanted to give you an idea of the breadth of our program and what we've been working on over the last year or so, I suppose. So we can kick right off with the next slide, thanks. Okay, so overall our aims are to work with people, individuals, community members, organisations, local communities to enhance the overall well-being and solutions provided to regional communities. So we're specifically looking at a focus on mental health because most of us are from the School of Psychology, but our focus over time is evolving and broadening into more health and mental health focus. So we're looking at ways to first identify the unique needs of individuals and practitioners and professionals living and working in regional communities. So we know that there are disparities in terms of the health and mental health outcomes for people living and working in these communities. And this isn't just accounted for by lack of services, but it's certainly a big part. So a big aim of our program is to examine what these unique needs are and then to identify and develop innovative solutions to help take quality services to the regional areas. So in doing so, we're also building the capacity of regional health providers, so providers who are providing that support to the regional community members. And in doing that, part of the focus will be e-health solutions. So we have members of our team who are working quite closely in the e-health space, whether that be through apps or online interventions or just using innovative technologies to meet the needs. Next slide, thanks. So you'll see on the screen some of our team members, and the reason we wanted to talk about this is we've got a large team in terms of our academics, but what we've been most excited about in the last 12 months or so is the staff that we've brought on board. So we've built quite this multidisciplinary team. We've been very lucky to bring on board some new research fellows, so Renee Ireland, Mandy Casamadis, Bonnie Clough is there, Luca Byrne and Jeffrey Guth as well. So our team is growing, and with that comes a big skill set and broadening into new areas. So we're lucky enough to bring Renee on board, who has particular expertise in military and veterans, health and mental health. Mandy brings with her specific focus in health psychology and diabetes, and Bonnie brings with her a focus on use of technological adjuncts to therapy. So we've got lots of options here in terms of the projects moving forward. Next slide, thanks. On the screen are just a description of some of the projects that we've kicked off over the last year. So we're trying to get a few different projects going in various areas. So we're looking at projects that include the national rollout of an online intervention for youth anxiety. So fortunately we've partnered with Beyond Blue, who've provided some support to provide this online intervention for youth aged from 7 to 18 years of age. And anybody in Australia can access this program completely free of charge. So we're getting out into as many areas as we can with that one. We're fortunate enough to have Michael Ireland on board, who's developed a mindfulness intervention, a resiliency program for practitioners, and in the first instance it was medical practitioners, and he's now extending that with Bonnie to roll that out for GPs in regional areas who are particularly under stress with how they can help manage the mental health needs of and even just health needs of the community members. We've got various other projects happening, developing apps related to mindfulness and resiliency. We've got members of our team who are looking at the application of digital literacy skills to how we do psychology in the digital age. We're looking at how community members, particularly regional community members, might actually embrace e-health technologies, and various other projects. Next slide, thanks. On the screen now, we've got our PhD students. So our biggest focus in the first year has been to try and bring in those PhD students, like Mark and Peter were saying. So these are our key to our program. We need students to keep them going, and we've been very fortunate to kick off 6 new PhD students in the last year, and we've got 7 more lined up for next year. So we should see some quite active research around the departments. As you can see there, we've got PhD students who are examining mental health of farmers, and in particular looking at barriers and facilitators to help seeking in terms of mental health, and we know how much of an issue this is. We've got students who are examining autism spectrum disorders and transitions of young people with these disorders, particularly in regional areas. We've got students who are examining regional disparities in terms of physical activity and how that links to various mental health and health conditions, and students who are looking at breast cancer sufferers and examining how we can track their performance over time. Okay, next slide, thanks. Okay, the other thing that we've been really thankful for in terms of being able to find extra support is some of our funding achievements. So Dr. Charlotte Brownlow at Toowoomba campus has been quite successful in the disability space. So she's secured some funding in terms of building interventions and understanding more about how we help people with disability transition into positive, successful outcomes in terms of workplace and study, in particular in the regional higher education space. She's also working on a critical autism network, which is across 5 national contexts, so we're building a lot of our international collaborations that way as well. One of the next projects that Michael actually is going to come up and talk to you about in just one moment is our partnership with the Cancer Council. Queensland Cancer Council, and this has become quite an important partnership for us in the university, and I'd like to invite Dr. Michael Ireland to the stage to tell us a bit about this project and where it's going over the next 5 years. Thanks.
Okay, can we skip over? We're going straight over to my slides. So Sonja told me I was allowed to have 2 slides to describe this program, so of course I went around looking for the smallest font I could possibly find, and when you see it come up, you'll see. And I managed once again to outwit Sonja and put everything down I wanted to. So this tells the story of the partnership that's been building, and I won't go through all of these points. So these slides obviously are going to be made available if people want more information. They can also contact me. But initially, the Queensland Cancer Council, who conducts a lot of epidemiological research, had started noticing a trend in their data in which people across different rural and regional parts of Queensland had poorer incidence rates in cancer and poorer 5-year survival rates for different cancer diagnoses. So they looked, as epidemiologists, they looked to control several factors for this, and they found that this discrepancy still persisted despite controlling for treatment factors and community factors. So Mark Harvey, John Cole, Erin Raymond and myself initially went out to Queensland Cancer Council, and we had a meeting with them, and we pitched some research ideas. We said if we had an issue like this, as mental health researchers, we would attack it like this. They liked a few of our ideas, and we began a partnership with them. Initially, we started meeting regularly to discuss research ideas. Then we planned to complete a systematic review of the evidence that was already available on this topic. And we also hired Mandy. Mandy's a postdoc research fellow who now works with us, and she has spearheaded a lot of the actual work that's gone on with the systematic review and developing a research proposal. So up until now, this relationship has flourished quite a bit, and we just recently signed off on an agreement with them with quite a bit of research funding attached to make sure this program survives over the next 5 years. If we jump over to the next slide, I'll point out some of the aspects of the project that we're going to be looking at. So what we're looking at now is we're looking at staffing the program over the next 5 years. We're looking at hiring some people in key positions and leading the paper. We're looking at developing research output from our systematic review, and we're also looking at building the initial stages of the research. So we're looking at qualitative studies which are already underway. We're doing interviews with rural GPs, and we're looking at also doing interviews with cancer sufferers and their families to start gathering some insights from people living in these communities about the experience of cancer, survival with cancer and treatments for cancer, and how they may differ across different regions. Following that, we'll be looking at quantitative research, where we take some of those factors that we've uncovered through our systematic reviews and also through our qualitative research, and we begin to test those factors across different regions using some cross-regional comparisons and things like that. So that's where the program we've just kicked off. We've been running now for about 6 months, and Mandy and the team have done some great work in getting some key data so far, and the 5 years starts now. Is that everything, Sonja? Any questions on that particular project or on the rest of the program which Sonja was discussing?
No questions?
Yes.
I'm interested on the.
Sorry, would you be able to go up to the microphone?
Oh yeah, thanks. I'm interested on the quantitative aspect of this, cancer research. So, what do you want to test actually empirically?
We're not entirely sure what the factors are yet because we're only just starting to look at the data. But as a result of this systematic review, we're starting to find that things like communication between the specialist and the GP within a particular community can be a key factor driving the success of treatment. So we're trying to mine the existing data at the moment to get some insight into what factors might be producing these disparities, and the qualitative data, which is only just coming in now, we expect will also provide a host of variables that we can start exploring.
Okay, yeah, that's my question.
So we're not trying to anticipate too much at this point, but we expect within the next 12 months we'll have a wealth of information to suggest some factors which is driving this issue, and we'll start to test those quantitatively.
Testing means maybe you are going for field research,
Correct.
sampling survey, and
Yes.
those things.
So then there'll be some follow-on studies. Once we identify the factors that are causing the problems and the disparities, then we'll provide some follow-on studies to try and intervene and alter those trajectories.
Yeah, it would be really interesting.
Yeah.
Thanks.
We'll keep you updated.
I have a question. One of the interesting things about the strategic research programs, of course, is that they are articulated through the framework of the institutes. With the Institute for Resilient Regions, and this is, I guess, a question to both of you, how much have you had to think about how you align your work with notions like resilience, for example, to express, I guess, a theme that sort of is consistent with what the university tried to do in setting up the institute in the first place?
I'll take first step.
Yeah, go for it.
Thanks, John. There's a couple of aspects to how we've tried to align our work to the Institute for Resilient Regions. So there's two aspects for us in terms of building resilient regions and communities. So there's this notion of our work in the mental health space and even the health space really can apply to across the board. It doesn't have to be only applicable to regional areas, but certainly we've tried to adapt our research program moving forward to be able to do both. So in order to have more impact and to align with the university, we're looking at projects that can help us answer bigger picture questions about health and mental health disparities, but with a particular focus on local and broader regional areas, so that we're able to help in terms of building that resilient sort of regions. The other aspect of that you alluded to was the resiliency kind of theme. And it's something that's coming through a lot more in psychology and mental health research generally now, in the sense that, yes, we have a lot of mental health conditions that we need to be examining. So, we have a lot of people around the world who are suffering from various mental health conditions, but there are many more who are thriving and are resilient, and it's important for us to understand both. And so moving forward, and that's where it particularly comes in handy with someone like Michael on the team, who has that theoretical knowledge and ability to tease those things out and look at those frameworks a little bit more thoroughly and look at what might set someone down the trajectory of resilience as opposed to sort of mental illness or whatever it might be, and then place that within the context of regionality.
I just wanted to add one quick thing to that. One of the focuses Sonja and I had initially in putting together the team and the program was to look at where we had existing skills and expertise and knowledge, content knowledge. and then looking at how we could use that knowledge, and we do this with our PhD students as well, to increase resilience broadly defined across different regions. So we may have a PhD student or a postdoc contact us, or researchers from outside who have certain areas that they're already researching. We see our job as helping steer that towards having implications for different regions of Queensland and improving community resilience as well as individual resilience. So some of the projects that Sonja had listed up, they would be projects that prior to our involvement may have had no emphasis on different regions of Queensland or on improving resilience. And our job has been to put a team together which drives everything in this direction of resilient regions.